Hi, I'm Emma Smith at Embark Behavioral Health, and today I'll be talking about if data culture predicts survey completion rates. Embark Behavioral Health operates on a continuum of care of outpatient and inpatient adolescent treatment centers throughout the country, and we were curious if this obscure concept of being data-driven and using data culture can predict survey completion rates or the amount of data we actually get back in our hands. I work with a lot of really intelligent data-driven people, but sometimes we don't get enough data back to inform our care and use measurement-informed care throughout our programs. We used a survey, a 27-item survey that produced a composite data culture score that assessed data culture across 3 categories. We measured the amount of frequency that surveys or outcomes are discussed throughout treatment with our clients and families or internally with staff and leadership at our programs. We measured the confidence and comfortability that staff feel using the measurements and talking about surveys internally with their teams. And we measured the standardization and the protocol for administering surveys. So how comfortable and how standardized the assessments are actually being sent out. We sent this data out over 1 quarter, so throughout January 1st through March 31st. And we sent it out to 2 distinct populations of people at Embark: clinical directors and office managers. Clinical directors are people who oversee therapists and the clinical staff at their respective programs. And office managers actually send out the surveys to clients and staff. At Embark, we don't send surveys out through an automated robotic system. We believe that clients should be able to actually answer questions or get their questions answered and talk to people when they're administering surveys. So we received our data back throughout 1 quarter, and we analyzed our results through Excel and our survey administration platform. And then we looked at a correlation between the composite data culture and survey completion rates. Results were strongly correlated between survey completion rates and data culture. We have that charted right here on this figure. We also have a discussion subscale that was strongly correlated with completion rates. The standardization subscale was only moderately correlated, so not as much really. Then we separated results between clinical directors and office managers' data culture score. This was interesting because we saw that clinical directors' data culture score was strongly related with completion rates, but office managers, not so much. Only a slight correlation was there for office managers. The discussion subscale was positively correlated for both groups of people, however, for clinical directors and office managers. But the standardization subscale was moderately correlated for clinical directors at specific testing instances, at admit and discharge, but not throughout treatment. Moving forward here, we really encourage every program, so you included, to run a temperature check of your own data culture and see how your programs compare here. It's easy to do. Just ask your teams and complete a similar survey that asks about the frequency of how often your staff are discussing outcomes, how comfortable they are using the measurements and just talking about them, and how you're standardizing them. And because we saw data culture to be so strongly correlated with completion rates, for clinical directors, it really matters how your leadership is talking about the data. So start at the top. Leadership sets the tone. And then we recommend standardizing routine collection throughout treatment. We did not see a strong correlation with standardization during treatment, only at admit and discharge. So the more you standardize outcome assessments during treatment, the more data you'll get back throughout treatment. And then we kind of sum this all up with 3 Ds: discuss, discuss, discuss. Discuss results internally during treatment. Discuss results with clients and families so they're aware of their results. They buy into the concept of measurement-informed care and they know what their data is saying. And discuss results with yourselves. reflect, get comfortable with the measurements, and understand the data so you can continue your own data-driven culture. If you have questions about this, please feel free to email me. My email is emma.smith@embarkph.com. I would love to hear your thoughts.